This diary focuses more on my experience with medical professionals, doctors, GPs, hospitals, surgeries and procedures and things that I've had along the way. So yeah, some of this stuff is quite difficult to talk about. Anyone that goes through endo probably knows that, like, one of the things we deal with is just having to really advocate so hard for yourself, gearing up to going into an appointment, having your notes, having your diary sometimes of your symptoms, and being able to really articulate what you're going through and push for like help, support, treatment of some sort. But unfortunately, things don't always go smoothly. Things almost never go smoothly in my experience. In fact, have never gone smoothly, and it's something that's navigated every single day. It's not the kind of condition I find where they find out what's wrong with you, they give you the surgery, they treat you, you're healed. Endo couldn't be more of the opposite to that. I mean, it takes so long to diagnose, so difficult to treat. It's not curable, so it always comes back. So many things don't work. So many things don't have any answers. So yeah, it can be difficult. But yeah, I'll stop talking now and let the next diary commence. So I've been seeking medical help for my symptoms for many years. And when I was younger, every time I'd go to the doctors about my pain, I was told that I was just unlucky and that I had bad periods and that they were common. They could run in families. My mum had bad periods. I was just going to have to learn how to manage that. I didn't feel I got really any support when I was younger. I mean, I was getting sent home from school every single month, throwing up profusely, like really not normal. In addition to like throbbing pain. But I was just, told by the doctors, take paracetamol. I didn't feel like I got any support, and nothing helped. Nothing was offered to me that was exploratory or investigative. I think I remember having my first ultrasound around the age of 17. So I'd been going to the doctor since I was 13. And the ultrasound just showed nothing. I think it picked up 2 little fibroids at the time. And then after collapsing in public from an extreme flare-up and literally just losing consciousness from the pain, it was that GP visit that I remember they put me on the pill. And that was kind of my fix for the following 10 years. At the age of 19, I was put on the pill. But yeah, I just felt that whenever I'd go to the doctors about this, they would say, you have bad periods. It's unfortunate, but you're going to have to learn how to live with this. Eventually, after I'd been on the pill for some time, and then I was reporting that, the pain is back just as bad as before, I eventually got referred to have a diagnostic laparoscopy, which was around about 2014, 15. And I remember in the lead up to the surgery, I was having consultations with doctors that I'm guessing were a part of the consultant's team. I never once met the consultant who operated on me. I just met members of his team. I'd had ultrasounds and, conversations around my symptoms, but I remember on the day of my surgery seeing the doctor who was going to be doing my surgery and saying, oh my goodness, please. Respectfully, I trusted that he was going to do the best he could, but I was like, I've been suffering for a really long time. Like at this stage, it had been about 17 years of symptoms, and I just said, please, just please be as thorough as you possibly can. Like, I was just desperate, And I remember him being very kind of like blasé, a bit dismissive of me, just kind of nod and disappeared off. And then after that surgery, I remember waking up, my wounds had come undone. I'd been glued and it had all, I'd had problems. Like my wounds did not stick properly, and that led to eventually having to have keloid surgery because I developed keloid growths where the wounds hadn't been properly sealed. And I came to find out that they didn't bother to take any biopsies, didn't bother to test any tissue. It wasn't an endo specialist who did the surgery. They just had a little look around on the surface of my organs and felt that everything looked fine. So that was the first time, like, I was quite devastated to find that, you know, they said everything looked fine. And I was just pretty hopeless after that. I thought, you know, I've waited years and years to have this surgery. Surely they're going to find out what's wrong with me. And it wasn't the case. So after that, I felt there was a lot of minimization. It was all down to, oh, it must be your diet. You probably have IBS. You need to look into nutrition and diet. And they did a colonoscopy and said it was fine, and just said, you know, there's nothing that we can do to help you. You know, they said I probably had some hormonal issues. They put me on antidepressants to help manage PMDD, because they were saying, you know, I've got extreme forms of PMS. And it was all a guessing game. It was all a kind of reframing. You know, you've got some menstrual issues, you've got some gynecological struggles. So that was where I was left at. Eventually, a few years later, I remember being referred eventually to see a specialist because I'd had an ultrasound that had picked up polycystic ovaries, and they were concerned about that. And I must say, when I met the endo specialist, who I ended up being under their care for quite a few years, I experienced validation for the first time, because when I told them the symptoms I was having, they initially said to me immediately, it sounds to me like you have endometriosis. And I said, no, I don't. I've been tested for that. I've had the surgery. I don't have it. And I remember they were like, well, no, it's very possible that you had a misdiagnosis, because your symptoms from the onset of your cycle sound like endometriosis. And if it wasn't an endo specialist that did your surgery, they could easily have missed it. Because there are places that they don't look. They tend to look on the surface of the organs. They don't look behind the uterus and in the pouch of Douglas in certain areas. So that specialist did an internal exam on me there and then. And I remember they said that they could feel scar tissue, and were very convinced that I had endometriosis, and that they'd send me for an MRI. And the MRI did confirm deep endometriosis, and I had surgery following that you know, excised it. So I had a good experience at the beginning of my journey. I felt validated, I felt heard. I couldn't believe that after all these years, you know, it had been identified. But then things got complicated. I think having a complex condition where there's no foolproof answer or solution to these problems can cause things to unravel over time. And I've had some difficult experiences, definitely some difficult experiences. I've gone into surgery expecting a certain outcome. I experienced undergoing a surgery which did remove some endometriosis, but then later came to find out that the endometriosis I thought had been removed hadn't been. So I thought I had removal of deep infiltrating endo, and then I find out 3 years later that it was peritoneal surface level endo that was removed. And then I've had instances where I've needed another MRI. I've had multidisciplinary teams conflicting, saying things that maybe my consultant is disagreeing with. I'm being told I need an MRI to corroborate if things have remained the same or changed since my previous ones. And then I've been told, oh, just have an ultrasound, even though every ultrasound I've had over the years has never picked up my endo. Even from when I was, you know, a teenager, it only picked up my fibroids. But yeah, I've had experiences that don't make sense, you know, pushed to have an ultrasound which doesn't identify my endo, and then been told after having the ultrasound, oh, see, everything's fine. And then pushing for an MRI months later, only to have confirmation that the same endo that was there before my surgery was still there now. You know, things like this, things that just have been very traumatizing, and essentially just not having clear disclosure around exactly what's happening with my body. I understand that there are limitations that can happen with care and in terms of medicine and surgeries, but The one thing that I think is very important is transparency, especially when it comes to patients, because most of the time we're having to do a lot of advocacy, and if we don't explain our experience and our symptoms, nobody knows what's going on. So I just have definitely had a hard time trusting healthcare professionals, because I've come to find out that information that is very clearly documented has not been disclosed to me. And then it's been disclosed to me by other doctors who have looked at my notes, and it's sent my head spinning. And, you know, that does fracture trust, especially when your inclination told you all along that something wasn't quite right. So yeah, I've had experiences where I've been told conflicting things. I've been told something's not there when it clearly is. I've had things minimized down. So I've been told, well, just because you've got endometriosis doesn't mean that surgery is going to remove your pain, which I do understand. But I've had, you know, situations where everything's reframed to the fact that, oh, you have pain sensitization, you have adenomyosis, you have fibroids. In other words, let's forget the endo, because that's almost something we can't deal with. Let's just accept that you have these other things. I've had options pushed onto me that I never requested, such as hysterectomy and really final non-conservative decisions, very much pushed in my direction when it seems that there wasn't going to be an easy solution to my situation. I've had a lot of pushback on things that I think should have been more openly considered. I've had to accept lots of hormonal treatments and things that I didn't really want to put my body through because I wasn't offered the option of surgery, or I had to wait 3 years for a surgery, or, you know, all these kind of things. I've been on so many wait lists. I've had to do a lot of admin between teams or like trying to get triaged and referred, like having something like endometriosis. In my case, I've been under MDT teams, so I've been under like a bowel clinic. I've been referred for Urogyne, which I never got seen for. I actually got referred 3 times and discharged 3 times before I even got to see the clinician over a 3-year period. I've had situations like that. I've been referred to a pain clinic, shown up on the day, gone through the assessment, and then have been told, you have gynae issues, I can't help you. In other words, if it's not back pain or leg pain or muscular pain, I can't help you. You need to be seen by a gynae team when it's a pain clinic. Granted, I also have issues with joint and muscular pain and have undergone musculoskeletal physiotherapy too. So it's just, yeah, a lot of asking for help, a lot of saying my symptoms aren't improving, doing all the things that you're told to do, keeping the diaries, following the instructions, taking the meds, taking the hormones, putting your body through a lot, and nobody really knows the answers. And I just think there's just a lack of transparency, a lot of times, a lot of reframing when the answers aren't clear, and trying to kind of conflate things with each other, or in some cases maybe finding it hard to distinguish between conditions. So i.e. somebody has tummy pain, not initially understanding that that's related to a gynae condition, which I think we've moved along so much more now than things were very many years ago, and that was kind of the standard of care that was being received. But just even, you know, bowel and bladder issues that are occurring as a result of having a condition like endo or adenomyosis and not having it properly investigated, having measures put in place to help things, and then when it comes down to needing these measures to be implemented, having them not done, or having a very clear treatment plan or a very clear surgical plan, and then coming out and realizing that it hadn't taken place, and just very fragmented experiences, very disillusioned experiences, I must say. I don't doubt that there are some really amazing medical professionals out there that really care and will go above and beyond to try and help patients, but I've definitely experienced a lot of fragmented, traumatic things, and it's definitely fractured my ability to trust the people that are dealing with my health. And I feel compelled and very much I feel it's very much necessary that I have to really thoroughly explain my journey to any new health professional I come into contact with and give them a really cohesive, comprehensive picture of my experience. Otherwise, I feel like I just get dealt with like another number. And we know that something like endometriosis is a very unique individual condition that affects people also differently. So yeah, I think getting care and the right care and being listened to and heard and having healthcare professionals that are actually able to move the dial to get results has been near enough impossible. I'm speechless on the matter. I really am. I really am. I wish I could say more positive things, but I just think that there's a lot of strain systematically right now, and even trying to get a referral or transferred, like, it's just near enough impossible. I think trying to get results with your own health requires you to be basically, it's like a full-time job position being a secretary to get things moving for your own health. It's constant phone calls, constant email follow-ups, constant taking names of people, mediating between care teams, between points of contact, following up, re-explaining the situation a million times over. People that, know your case very well, constantly kind of forgetting things. And yeah, I personally have had a very difficult time with healthcare professionals. And as I said, I know there are some wonderfully compassionate and brilliant people out there that are really good at their jobs, but I have not had an experience that leaves me with a lot of faith or hope, unfortunately. And I just really hope things improve, because at this rate, it's even more destabilizing trying to navigate a condition like this on your own, self-advocating, and then being met with all these roadblocks. There just seems to be a lot of friction and struggle to get positive results, ultimately, for the betterment of care and well-being. So that's been my experience.